Good afternoon, Dr. Berger.
Good afternoon, Irina.
So, we constantly preach to our patients and everybody else that they need to do breast cancer screening, prostate, colon. Uh, any guidelines about skin cancer?
So there are no formal guidelines put together by the United States Preventive Services Task Force like there are for colon and breast and lung cancer if you've been a long-term smoker. Prostate cancer is kind of a discussion these days. But for skin cancer, there isn't. Although the American Academy of Dermatology feels very strongly that everyone getting into their 40s, the time we start screening for other cancers, should consider a full body skin exam once a year to make sure that they don't have any concerning lesions. Now, it should start earlier for people who have many moles, for example, nevi, 10, 20 moles, then you really should be seeing a dermatologist once a year to make sure none of them are changing. But it's really important for all of us, but especially people who have had a lot of sun exposure when they were younger, to be checked once a year. You may have something in a region that you can't see yourself and keep track of, or if anything is changing, and the way we worry, when we worry about a lesion is when it's changing. So there are what's called the ABCDEs of melanoma. Is the lesion asymmetrical, not round? Are the borders irregular? Does it have colors? Is the diameter larger than a pencil eraser? And is it evolving? Is it changing over time? Those make a brown spot that could otherwise be a benign mole much more worrisome. So it's really good, especially if you've had a lot of skin exposure or you have lots of moles, to be seen once a year by the dermatologist or your internist. And then anything that's really worrisome, the definitive way to make the diagnosis is, of course, to have it removed and sent to the pathologist and allow them to look over the biopsy specimen under the microscope and judge whether they really think it's something worrisome or not. The three forms of skin cancer are basal cell carcinoma, which is the most common and the slowest growing. Next is squamous cell carcinoma, still slow growing and not that invasive. And then there's the one we worry about, which is melanoma. Melanoma, even if it looks like you've eradicated it in the skin and taken it all out and you have clean borders and all that, it can, not that unusually or uncommonly, pop up in other parts of the body years later, in particular the back of the eye. So it's really important not to let things evolve and become malignant.
And you would recommend to do this annually, correct?
I would. My personal preference, what I recommend is when you're getting into your 40s, especially if you've had a lot of sun, you should get yourself in to see your internist or your dermatologist once a year for a full body skin exam. If you have a lot of moles, you should already be seeing your dermatologist once a year. They actually have computer-driven video means of basically keeping track of all the moles and their size and shape and color and all of that. And but if you're just the average person, who went to the beach a bit when they were young and didn't wear sunscreen because it wasn't the thing back then, you're somebody who certainly should be going to the dermatologist once a year for what they call an FBSE, a full body skin exam.
And what would be the preventive recommendations? I know that in 60s and 70s people were just putting oil and they were really bathing in the sun. I mean, now we have such a phenomenal progress and everybody knows that sun is can be extremely dangerous. What would you recommend on daily basis?
Right, so just a little quick review of sun protection. So of course, number one is is avoid the sun. Wear a big hat, stay in the shade, long sleeves, long pants, closed-toe shoes, and so forth. And there are a lot of fabrics that you can go swimming in now and they protect from the sun, or that you can wear on the beach. They're light and breathe, but they protect you from the sun. But when your skin is going to be exposed, you really need some sort of sunscreen. And bear in mind that we're talking about blocking ultraviolet radiation, UVA and UVB, which are really short wavelength beyond the visible spectrum, beyond violet, so they're ultraviolet and you can't see them. So you want to protect yourself from both of them because both A and B are associated with skin cancer. and aging of the skin too, but only UVA actually causes the skin to become red and get a sunburn. But you need to protect against both of them, so your sunscreen ought to be what's called broad spectrum. It should say so on the bottle, which means it'll protect against both. The SPF, or sun protection factor, and what that is just if you have SPF 15, it means it'll take 15 times longer for you to burn in the sun than if you didn't have it on in the first place. SPF 30 is fine. Going above that is really negligible benefit. And you should apply it every 2 hours if you're really going to be active in the sun, especially if you swim and so forth. But on a daily basis, we're all exposed to the sun a bit when we walk out of the house. So whatever moisturizer you use in the morning ought to be something that contains SPF 30 or so. There are a lot of great products out there. One of them that we believe in and we actually carry in the office, and it's only available in physicians' offices, is a product called Skin Better, which is made by the L'Oreal company. That's one we happen to believe in, but there are lots of products out there, basically anything that's got SPF 15 or ideally 30 that you put on a daily basis. And you want to think about protecting the ears, the back of the neck, and whatever part of the chest might be exposed to the sun a lot, just kind of as daily preventive maintenance, if you will.
And it's around the year. It's not only during summertime.
Right. Of course, in the winter there's still sun, albeit at this latitude where we are, about 42 degrees north latitude or so. It's not as strong in the winter, but if you are out in the snow, if you're skiing or snowshoeing or whatever, if you've ever done it, you've probably realized that you can actually get a sunburn from the reflection of the sunlight off of the snow into the face. So yeah, basically every day you should have something on that's going to protect the face, the neck, etc. Because it's also going to decrease aging of the skin, wrinkling and thickening and so forth. I'm sure everybody's seen people who worshiped the sun and didn't wear sunscreen when they were young, and you can see how aged their skin becomes.
Yep. Any final thoughts?
So the skin is not, the sun, I should say, is not really our friend. And if you need vitamin D and you need to get it up, you should take it as a supplement as opposed to worshiping the sun. Any worrisome skin lesions that are changing in any way, you should be seen by your doctor in the very near future. But for just general screening, to make sure we avoid anything becoming skin cancer, because these things do evolve from benign to worrisome to actual cancer. You should have a full body skin exam once a year with your general physician or your dermatologist to make sure that we're not missing anything. So I'll wrap it up here. We'll say we are Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics medicine practice located in Great Neck, New York on Long Island. Of course, everything that I share with you here is for educational purposes only and does not constitute medical advice. We have not established a doctor-patient relationship, and if you have specific questions or concerns about your health, you shouldn't hesitate to reach out to your medical professionals. If you want to reach us in the office, Northeast Medical Practice, 516-604-3418, online at northeastmedicalpractice.com, through all of our social media channels, all the platforms, including a YouTube channel, or you can listen to my interviews of medical professionals on our Longevity MD podcast on Spotify. But until we see each other next time, be in good health.
Thank you.